Morning, everybody. Good morning, everybody. Happy Monday. I know the weekends go by very fast. I wish we implemented here a 3-day weekend. I know some companies are trying to do that where people can just physically work 4 days a week. Many, if you're not in medicine, obviously, if you're a 9 to 5er. And typically those sessions, so those companies, you work from home. That being said, this is medicine, and unfortunately, we have to work all the time to make sure we do very well and move on, right? So I hope you guys had a wonderful weekend. I know it's always short, but one day closer is one day closer to your exam to then move on to rotations and or step two. So today we're doing immunology like we always do. This is why I do this, whether it's 2 people or 100 people. The webinars that we have twice a day in the morning, sorry, something's in the morning and the afternoon, it's just an ongoing review because I am trying to be the pioneer in step one, basically helping you guys get points for the exam. Many companies, I mean, I've launched many, we used to work on content, which is fine, but you can't reinvent the wheel. There's so much content out there. I can't, nor do I want to be able to teach you guys all the medicine. I can't. You have to be good at everything, right? And you have to go back and learn everything. And that was my mistake as a student, is I took time to go back and learn everything, but you don't have the time. Not saying to cut corners, I'm just saying figure out what you need to do, how to conquer it, and move on. Simple as that, right? So today we have immunology. Because we see immunology 4 times in a month, if you're with me for at least a month, you see it every Monday morning. Last Monday, we did what? We did congenital immune deficiencies. We talked about SCID, we talked about CVID, due Georges, and so on. So those are points that you can get on immunology. Will they ask you questions on that? Maybe. If you do get immunology questions, I can guarantee they're going to give you something dealing with either CGD or WAS, obviously. So if you're comfortable with that, one less thing to worry about. People get nervous when they take the test because they're not prepared or they didn't cover the material. Again, change your mindset. Like, I know you guys are here for a reason every morning. I thank you for jumping on. You have to say to yourself, what do I do to get points? So immunology, think of it, right? We're going to do some questions today. Today, we're going to do transplant questions, hypersensitivity questions, examples of type 1, type 2, type 3, type 4 hypersensitivity, examples of hyperacute, acute chronic, and GVHD. Why? Because they could either ask you questions on, think of it this way, hypersensitivities, right? They'll give you examples, or they'll present to you cases, and you have to know the example. At the same time, they can go a little more detailed, the pathogenesis, the terminology in immuno, which is very, very scary at times if you're not familiar with it. So I would always suggest and advise to open book it and move on for that, right? That being said, when it comes to transplants, right? Think of it this way, ladies and gentlemen. What do you have to think about when it comes to transplants? Many things, right? We have to think about what we have to think about. You tell me, thinking about timing, right? If it's hyperacute, days, week, days, month, minutes, hours, days, and weeks, versus what else? We have to think about. They give you pathological findings, right? So they're either going to give you timing. Clearly, they're going to give you some time, so you know specifically if it's hyperacute, acute chronic, or GVHD. They're going to give you some presentation. They can give you some association to some of the conditions that we know, right? So there is a nice little beautiful table in first aid, which we've done many, many times, and it explains to you specifically how to differentiate hyperacute, acute, chronic, and GVHD. You must need to know the terms. You must need to know the description, because I don't know about you guys here, but when I'm studying for an exam like this, I've never changed my thought process, even though I didn't have enough guidance back then. And everything I do today and every single day and every single day since I've started prepping for USMLE for you guys, with you guys, is give you something I didn't have. It's guidance, right? I say to myself, there's hyperacute, acute, chronic GVHD. There's 4. And they're going to give me timing, some timeline. They're going to give me some finding. I need to know at least 3 of the 4. I would know all four because why wouldn't I? This is what I usually do. But if you don't have it in you and you can't learn all four, or you forget all four, it's okay. Then learn at least three. Or else you're going to walk in and hope that they give you the timeline. But sometimes they don't give you timeline, right? There's questions we're going to have today. They don't tell you the time. They just tell you what's found on biopsy. And you need to know what you find on biopsy. So this is why I do this way. I know it's exhausting, but when I was studying, I used to always try to find all my weaknesses and learn all my weaknesses. Back then was a score. Now it's a pass or fail. I'm not saying you have to, you have to cut corners. I'm saying though that if you're constantly passing and you're doing very, very, very well, always on your assessments and your Q banks, you're good to go. That being said, try to get as many points as possible and try to see, and this is with every specialty, right, guys? This is not just immunology, this is biochemistry, this is microbiology, this is everything. Look at the bigger picture and say, out of all I see in cardio, out of everything I see in immunology, out of everything I see in microbiology, where am I comfortable in? Where do I get my points, right? Where do I see that if I see on the exam, I'm doing well? Because being honest with you, if you see something like, for example, cardiology, which is a huge system, people spend days, weeks to study, no problem. But you say, well, in cardio, I know I'm good in these parts. Okay, so you get all those points. Clearly, some things are very challenging. The physiology, maybe the valves, maybe the pathophys, but either you try to learn it watching resource videos, right? Online med ed, boards of BN, or your own notes or textbooks, or you say, listen, I don't get it, but I know how to get the right answer. This is how you survive step one, okay? Because I'm telling you guys as a friend, colleague, mentor, coach, your energy needs to be put elsewhere, meaning once you also have to harness your energy, because once you pass step one, if you're lucky enough to jump into step two because you're already a physician, then you have to put all that energy into scoring very high for step two. And if you don't have to take step two yet because you're in medical school, all that energy has to be put into doing rotations. So I beg of you, if you're studying for step, have a certain timeline, time frame. I keep asking you guys, let me know when your exam is, let me know when your assessment tests are, because we have to have a certain finish line. That being said, you have to get points. Don't try to learn everything. It's not possible in a short time frame. And I don't want you to fall into that trap of feeling like you're going to constantly try to catch up. Because once you feel like you're trying to catch up, it's an uncomfortable feeling. Okay. So we have immunology today. This afternoon, we're doing endocrinology. Every Monday morning, immuno. Every Wednesday, micro. Every Friday, biochem. I'm showing you what you need to do. And one more thing before we begin, always be honest with yourself and with me. If you're not reviewing, you will forget. This is one thing I've seen over and over again. The doctors that do well are the doctors that put enough time into reviewing. If you don't spend enough time reviewing, I can promise you're going to forget a lot of things, because unless you have a photographic memory, and if you did, you wouldn't be here. You would read it once and you would pass and you move on. So I promise you, I try my best to review for you, but you need to designate time every day, every weekend to review. All right. Raise your hands, guys, because I'm not doing these questions. I've done these questions. I've done them all multiple times. I finished both Q banks and actually working on other Q banks right now on the side to hack to see what else I can find. So I need you guys to raise your hands. I need you guys to participate, to do some questions live with us so we can see what you know. You don't have to put the video on. You just turn on the audio so I can actually hear what you're saying and we can move on. So it's nice that we have these sessions, because these are the sessions for me to work with you, to apply our knowledge, to see what we know, what we don't know, and how to work together for power of elimination versus power of application. So let's see what you guys know. Let's raise your hands. Dr. Fizz is on board. Raise your hand, Doc. Come on board. How you doing? How you feeling?
Hey, good.
Dr. Fizz from the West Coast. What time is it there now?
It is 6:12.
6:12. We have another doctor here. Dr. Singh is also sharing on your West Coast vibe. So thank you, ladies. Thank you, doctors, for jumping on. How was your weekend?
Good, good. It was good.
Good. You ready to do some immunology?
Yep, let's do it.
So let me ask you this. In immunology, because I know you're studying, you're taking a test in the near future, what do you feel? Because I ask everyone this. What do you feel about immuno? Do you think it's a strong suit of yours? Do you think it's a challenging topic? Where's the little tricks and strategies that you've seen by doing immunology for such a long time?
It's not that conceptually it's challenging. I think there's so many like little bits and pieces to it, so it's easy for little details to get lost if you're not, like you were saying, constantly reviewing. Like immunology is something you have to go back every single day and look at some flashcards or something at least.
Oh, of course, of course. I mean, so that being said, when you get certain questions on immuno, what do you think would be your shoe in, like your in, meaning when you get some questions, what do you feel you're very confident in or you feel comfortable with when it comes to immunology?
I think the hypersensitivity is like pretty much what we were looking at covering today.
Good, awesome. That's why you raise your hand, right? You're like, you know what? I'm good in this stuff, so I'm gonna raise my hand. And that's awesome. This is what I want from you, right? Awesome, good. So let me just share my screen, and then I have my first date open. And again, I know it's stressful, guys. It's a Monday morning. No one wants to really be working. Everyone wants to be either in the hospital or moving on vacation. But this is what you need to do to get to the next level, right? So let me share my screen. Looking forward to it. I'm excited when you guys know what you don't know. And what's nice is when we work together side by side, like we do every day, especially last week, we find new things together, new things to remember stuff, right? Whether it be a silly mnemonic or something to remember a few things. That's kind of pretty cool because then you'll never forget it. All right. Awesome. So, you know, the drill, we have the chat away on the text here. Dr. Fizza, take over. Do you? Let's see what you got. Let's take care of business. Let's do it.
All right, so microscopic examination of the lung shows diffuse eosinophilic scarring of the terminal respiratory bronchioles and near complete luminal obliteration by polypoidal plugs of granulation tissue. Examination of the skin shows no abnormalities. The findings of this patient are consistent with which of the following conditions?
So you want to go to the top and see what else we got?
Yeah. So
Let's do it.
investigator studying immune-mediated pulmonary damage performs an autopsy on the bilateral lung transplant recipient who died of hypercapnic respiratory failure, lung transplantation for idiopathic pulmonary fibrosis. So he's got a lung transplant, and based on the histological findings, we're going to see if it's chronic or acute, this different phases, right?
Mm-hmm. So do you want to, what do you usually do when you answer questions? Do you like to do do you eliminate answer choices? Do you try to shoot for the right answer? I mean, clearly when you do
Process of
simulation,
elimination there, I guess,
there it is. Start knocking stuff out if you can.
right? So you gotta forgive me here. It's been
It's
as you
okay.
know, it's been
Listen,
quite a while since I've looked at
but
immunology.
but the wonderful thing is we're here together as a team, right? We're here together as a team. This is what we do. We have people
Yeah.
chatting away. So we have different transplants here, transplant rejections. We have hyperacute, acute, chronic,
Acute,
and GVHD,
chronic,
right?
GVHD.
So let me ask you this. From these four, I
So
usually
it's
go,
not gonna be hyperacute, but that's
why not?
already out. Because the thrombosis hyperacute, you'd see like the pinpoint kind of bleeding, right? And
Yeah.
that's not there. This has got the mucus plugs.
And you see
The
that they don't
with
give you a
the
timeline here. That's
not the plug, the polypoidal plugs, I'm leaning more towards chronic rejection.
okay. So you see here, we have many things. We have diffuse eosinophilic scarring, terminal respiratory bronchioles, near complete luminal obliteration. So when you hear that, ladies and gentlemen, usually it's chronic, right? Because, for
Yeah.
example, hyperacute, and again, they don't give you onset, so that's out. But features of hyperacute, widespread thrombosis of graft vessels, okay, ischemia, fibrinoid necrosis. Be careful because there's also necrosis here too, right? There's different
Yeah.
necrosis. You have to be careful. So now we have the second one, acute. So we take out hyperacute. Is that fair to say? Yeah,
Yeah, that's out.
hyperacute's out. Right. Why is GVHD out? Wait, where's GVHD? Why do we take that out?
GVHD, it
What do
didn't
you know
say
about
anything
GVHD?
about there is different cell type that came in there.
GVHD, always remember is this. The GVHD, first of all, it's a type 4 hypersensitivity, right?
Yeah.
GVHD, 4 letters. And also, you will definitely see something with skin rash, some liver problems, GI problems, liver and spleen enlargement, right? It's going to be more
Yeah.
more like a systemic